Today we're diving into a topic that's both misunderstood and deeply important: medication dependence versus addiction.
Right? And the distinction between those two is often blurred, especially in clinical settings. It's caused real harm to people taking medications exactly as prescribed.
Exactly. Like someone on a benzodiazepine who starts experiencing withdrawal symptoms. They're often labeled as relapsing or having a new anxiety disorder.
And in reality, they might just be physically dependent, not addicted. Those are very different things.
Physical dependence is a predictable biological response. Addiction, on the other hand, involves compulsive use despite harm.
Which makes it so frustrating when providers treat both the same way. It's not just inaccurate, it's dangerous.
Especially when it leads to rapid tapers or inappropriate behavioral therapies. That's not what these patients need.
What they need is careful, slow tapering and physiological support. Not to be sent to detox or rehab designed for alcohol or opioids.
And not to be shamed. If someone follows their prescription and still becomes dependent, that's not their fault.
Exactly. Creating a shame-free space is essential. It validates that their experience is medical, not moral.
Let's talk about patient-directed care. I love how it flips the traditional medical model.
Totally. Instead of the doctor dictating the taper, the patient leads. Their nervous system tells us more than any protocol can.
Withdrawal schedules should be flexible. Real healing happens when the patient sets the pace.
And faster is not better. Tapering too quickly can cause long-term suffering. It's just not worth the risk.
That's why when in doubt, slower is safer. Always.
I also find the telemedicine approach really powerful here. It shifts the dynamic.
Yeah, being in your own environment during care makes a huge difference, especially for people with sensory sensitivity or mobility issues.
And it helps patients speak more openly. No waiting room anxiety. No harsh lighting.
Plus, access to specialists isn't limited by geography. That's huge.
Especially for people tapering benzodiazepines. Finding someone who truly understands is rare.
Right. And that expertise matters with things like liquid titration or hyperbolic tapering. You can't just Google your way through that.
No way. Cross-tapering? That's chemistry, not guesswork.
And let's not forget, many people were put on these meds without full informed consent.
That's a serious issue. Patients deserve to know what they're getting into and how hard it might be to come off.
It's not just about stopping a med, it's about supporting the brain as it heals.
And healing isn't linear. One week you feel fine, the next week everything's on fire again.
That roller coaster doesn't mean you're failing. It means your nervous system's doing the best it can.
And providers need to understand that. Stop expecting people to bounce back in a month.
Neurological recovery can take months, or even years.
But it happens. The brain is amazing when given time and space to heal.
That's why we need to rethink conventional treatment settings. They often do more harm than good.
Yeah, group therapy and confrontation don't help someone tapering off psych meds. It can actually traumatize them further.
Especially when withdrawal symptoms are misdiagnosed as relapse or new psychiatric disorders.
It's heartbreaking. People leave worse than they came in.
That's why we focus on education too. Patients need to understand what's happening in their own bodies.
Knowledge is power. It gives people back control.
It replaces fear with clarity. You're not going crazy, you're in withdrawal.
And with that understanding, patients become their own best advocates.
Whether it's medication dependence, food addiction, or alcohol use disorder, education is key.
And treatment should always address the whole person, not just the symptoms.
Mind, body, and environment. That's real healing.
So maybe the question we leave our listeners with is this: what would healthcare look like if patients led the way?
And what would healing look like if it truly respected the brain's timeline?
Something to think about.